Hello and welcome to FESTIBA Week, where the CHAPS program here at the University of Texas, Rio Grande Valley is presenting our CHAPS class presentation titled The Rio Grande Valley in the Time of the Pandemic, a Community Response to COVID-19. And this presentation will be given by 3 students who were participating in our CHAPS class in the fall of 2020. Colleen De Guzman is an undergraduate student majoring in mass communication. Cindy Oos is an undergraduate student majoring in anthropology, minoring in philosophy and sociology. And Nydia Salinas is a graduate student majoring in fine arts and specializing in ceramics. I am one of the mentors, Roseanne Bacha-Garza, and one of the instructors for this course, as is Dr. Russell Skowronek, who is the founding director of the CHAPS program. Next slide, please. So this is the name of the class, in case any of you are interested in taking it. We teach this class every fall semester, except this particular year, because of the pandemic and because of the limitations we had with actually visiting people. Normally the class is called Discovering the Rio Grande Valley, the Natural and Cultural History of South Texas. And we normally study a farming family of Edinburgh. And we do hands-on research at a farm in Edinburgh, and we do historical research, anthropological research, archaeological research, geological surveys, and biological surveys of the property. This particular year, because of the COVID-19 pandemic, we switched gears, and the students who were registered for the class kindly obliged to change the subject matter altogether and endeavor into this project with us with regard to the Rio Grande Valley in the time of the pandemic. So in case some of you who are listening and watching are interested in taking this course, we do offer it in the fall every year, and it does result in you as a student being a published author of a report that you all create together as a class. So these are the call numbers for the course. It is cross-listed through anthropology and history, and we do offer a graduate level course through the anthropology department. So it is upper level undergraduate and graduate level students in the class. I've provided our CHAPS program contact information on here, and I will show this slide at the end of the presentation in case you miss it. Next slide. So with regard to this particular subject matter, I just wanted to give you a little bit of background as to how we conducted the class and what the students were able to gain as far as knowledge and information with regard to the pandemic that we are going through and we are still going through today. So in addition to readings that were assigned for these different subject matters throughout the class, we had guest speakers come who have expertise in certain fields that had to do with what the students would be researching and studying in this class. So the students not only got the benefit of having this class being team taught by 2 professors here at UTRGV, but we had brought in, and we always do when we teach this class, whether it's the farming family study or this particular class, we always bring in outside experts in order to inspire the students and to give them the insight that they have worked so hard to achieve. So we had Dr. Amy Hay give a presentation to the class with regard to the 1918 Spanish flu pandemic and what happened in the Rio Grande Valley of Texas during that time over 100 years ago, and to talk about what some of the similarities were and the differences were between the two time periods. Dr. Isidore Flores came in and from the International Valley Health Institute and gave a lecture on Rio Grande Valley health as a community and as a culture. Dr. Ann Millard also came in as a guest lecturer to talk about rural public health, considering the location of the Rio Grande Valley of Texas and that a lot of the population down here lives in rural settings. And with regard to public health, that was very interesting. Dr. William Donner here is a disaster studies professor here at UTRGV, and he gave a lecture with regard to disaster studies because of how the pandemic is affecting our region, and it has been quite disastrous with regard to the fallout because of how our region has been so affected by it. And then Dr. Russell Skowronek gave a lecture about epidemics and pandemics in the Western Hemisphere and its effects on cultures and the effects on ethnic populations. And then I gave a lecture about the cultural evolution of South Texas populations. So this gave the students a very strong backbone of information with regard to the subject matter that we were studying. And then in turn, they did their own individual projects where they chose a particular subject matter to study, and they interviewed people, created oral history interviews that are going to be held in our Border Studies archive, and they covered various subject matters. So as we start our presentation tonight, I introduced the students already, but I would like to say a little bit further about what they're going to be talking about, which covers the different subject matters that our students chose to cover in this class. So Colleen De Guzman is going to talk about why the Rio Grande Valley was so susceptible to the coronavirus and why our region was hit so hard with this pandemic, especially over the summer. She'll also talk about frontline workers, and then she'll move into talking about how the educational system here was affected by the pandemic. And then Cindy Oos is going to be talking to you about a comparative analysis between the 1918 Spanish influenza pandemic and today's COVID-19 pandemic that we find ourselves in, that she will talk about similarities and differences and lessons learned. She'll also talk about the news coverage and how our population has been apprised of the information that has come about because of the COVID-19 pandemic. And then she will also talk about restaurants and how workers in different restaurants have been affected, whether it be through unemployment benefits or business owners being working with the loans, the PPE loans from the government. And then Nydia Salinas will wrap it up with a talk on immigration and how immigrants in our region have been affected by this pandemic. She will talk about social gatherings and our cultural background here and how social gatherings are very important to our region. And then she will talk about art and culture with regard to community public health, cultural resilience, and mechanisms for inclusivity. So with that, I'd like to move to the next slide and hand it off to Colleen De Guzman.
Thank you so much, Professor Bacha Garza. And thank you everyone for tuning in to our presentation today. We all really appreciate the time you're taking. We also hope that in this next hour, you're not only more educated and aware of how the Valley is combating the COVID-19 pandemic, but in some way or form, you become more hopeful, or this leaves you more aware of how people are resilient in our region. Like Professor said, I'll be talking to you today about our frontline workers and our education field. If there's any group of people who have seen how vicious and ruthless this virus could be, it's those in our hospitals and those in our clinics. It's the doctors and nurses and physician assistants and pharmacists. This is a photo of a nurse at the Doctors Hospital of Renaissance in Edinburgh, and you can just see the exhaustion in her pose. And this is probably the only minute she got to have for herself in between taking care of how many patients she's been caring for. This photo was taken in the middle of the summer surge of COVID cases in this region, which I will go into later. So to understand what our healthcare field had to face, let's first understand the numbers and why it got so bad here. These are the number of cases and deaths in the region as of February 19th, which was last Friday. So on Friday, we had 72 cases of the virus and 2,500 deaths, while the state had 2.5 million cases and 41,000 deaths. And from those numbers, Hidalgo County accounted for 2.8% of the state's cases. And that makes sense because according to the last census, our county accounted for 2.99% of the population. The virus doesn't discriminate. It's going to spread to whoever is in contact, whoever gets it. It doesn't care about age. It doesn't care about your income. It doesn't care about your race. It will spread at a rate that is going around. But what is most alarming is the fact that Hidalgo's county death toll of 2,500 deaths accounted for 6.16% of Texas's overall fatalities on Friday. That's twice the amount that it should have been. And it's not because the virus is much deadlier here. It's not because we have a different strain, but it's because our region, our population, our community was more vulnerable, was put in a more vulnerable position because of various reasons. So to understand the COVID-19 pandemic in the Rio Grande Valley, we should first understand two epidemics that have plagued this region for much, much longer: diabetes and obesity. Dr. Ivan Melendez, he's Hidalgo County's health authority, which basically means he's the top doctor of this county. He said at least 70% of the people who have died because of the virus in the Rio Grande Valley were fighting either diabetes or obesity. Diabetes is known as a silent killer. It happens when a person's blood sugar is too high because their pancreas fails to produce enough insulin. So insulin is an important protein that regulates how much glucose is in someone's bloodstream. And glucose is everyone's main source of energy. So since there is an irregular amount of glucose being used in someone's body, that basically means that they're not getting the nutrients they need. Their circulatory system and their immune system is having to work harder every single day to make sure that this person stays healthy. And for decades now, for centuries, the Valley has been an epicenter for diabetes. The rate of diabetes in Texas is 1 in every 10, while in the Rio Grande Valley, it's 1 in every 3. And it's also important to note that since Hidalgo is 90% Hispanic, Hispanics are twice more likely to develop type 2 diabetes than people who are white. A couple decades ago, the healthcare community created diabetes to the Rio Grande Valley. Because one of these chronic diseases, more often than not, leads to the other. So obesity, when someone is obese, that basically means that they have an excessive amount of body fat. They're in a constant state of swelling and inflammation, which basically means that their circulatory system has to work a lot harder to supply the nutrients and oxygen that someone needs. So in the case that a person gets sick, their immune system has to work a lot harder to defend them. They're put at a more vulnerable state to any chronic disease that this person would have to fight. And the statistics of how often someone is obese is almost parallel to that of diabetes, which is 1 in every 3 in the valley, and in the state it's 1 in every 10. Dr. Juan Sarmiento, he's the pulmonologist for South Texas Health Systems. On June 24, he told the Monitor that every single person in the hospital who was fighting COVID-19 was overweight. He also said, "We don't cure the virus. We basically are just trying to help them survive it. We do our best to make sure you have the best chance at surviving. The more fit you are, the more fit you will be in surviving the virus." Every single person who contracts the disease, who goes into the hospital for the disease, who dies because of the virus, who gets a test, a medical worker and a frontline worker is required to help this person, whether it's taking the test, whether it's giving you medication, whether it's intubating the person, whether it's collecting their body. Healthcare workers are important in this process. So the reason why these two diseases were the leading comorbidities of COVID-19 was because diabetes and being obese affects a person's blood flow. And so that's exactly how COVID-19 attacks. We initially thought that COVID-19 was a respiratory system because the initial symptoms of it was coughing and being short of breath. The way the virus spreads is through respiratory droplets. And so COVID-19, as you can see, this is the virus. When it attaches to someone's healthy human cell, it hijacks, and it multiplies. And so the first place it's going to do that is in someone's lungs. And so that's where it immediately starts to attack. And soon after that, the lack of oxygen that is going to be circulating in someone's blood will affect other body systems. And that's why COVID-19 is, that's how it's vicious, and that's how it is even more vicious when it's compounded with diabetes or obesity. On July 9th, 2020, our county judge, Richard F. Cortez, said, "Several months ago, I was warned of a potential tsunami if we didn't take this more seriously. The tsunami is here." This happened 2 weeks after Governor Greg Abbott raised restrictions on where people could go and where people could go. And this is when we saw huge waves of COVID-19 cases. In one day, we got 1,724 new cases when we were used to seeing 20 cases a day. In a matter of 2 weeks, hospitals saw a 70% increase in capacity. They were thrown off guard. They didn't have enough beds. Hospitals ran out of space. As you can see in these pictures, it was just too much for them to bear. These are the numbers from the summer surge. You could see how exponentially how exponential the cases and deaths rose. You can see that from June 30th to July 31st, it tripled, because these were the months when the most cases were being reported and more people began going into the hospitals. These are the main hospitals in the Rio Grande Valley. They are the largest hospital systems. And just to give you an example, just so that you could understand how our hospitals had to brace, DHR had to open a third COVID ward because of how many cases were coming in. They turned their rehab center into a COVID ward, and also their physical therapy center. Valley Baptist Medical had to turn their elective surgery floor into a COVID ward. South Texas Medical Systems and Rio Grande Regional had to start sending patients to San Antonio because they were at capacity. There was a point when Valley Baptist had 131% capacity for weeks. And I was looking through some of the archives of the Monitor, and this quote really stuck to me. What was it that Sir William Ulster said? This is Dr. Armour Force of DHR speaking. He remembered this one lesson that an old doctor taught him. A good doctor treats the disease. A great doctor treats the patient with the disease. And that's what we can't lose. We can't lose the ability to treat the person with the disease, and that's the empathy part. So on top of having to care for these patients, nurses continued to fight for every single person that they had. They would call, they would FaceTime the families to keep them updated, even though they couldn't see each other. They continued to just show empathy in multiple ways to these patients. They would pray with them if they had permission. They went on lengths to make sure that they didn't feel just trapped into their hospital rooms or even sharing in their small spaces. They made sure that they still felt human and that they knew that they were being well cared for. On July 22nd, Governor Greg Abbott came because of how fast the COVID-19 pandemic was spreading here. He came to announce that he was going to help turn the convention center into a COVID ward, and hundreds of state nurses from all around the country came to join our medical field. And I think that these nurses are, if they're still doing what they're doing, it's because it's out of their heart. And I think that the best way we could continue to help them is by continuing to wear masks and to continuing to take care of yourself. And I'm sure that that's what they would ask for. I'm gonna move on to my next section, which is education. When the COVID-19 hit in spring break in 2020, these education systems were not prepared. No one could have prepared for having to completely move remotely in the matter of weeks. Some schools had to extend spring break just because no one understood or no one was prepared to start teaching through screens. So one of the main problems that was brought into light because of the COVID-19 pandemic was that a lot of kids depend on school districts for food. It was something that no one really understood yet, but the RGV food banks lines multiplied by 7, serving around 142,000 people a week. And if you think about it, students depend on schools for food, for breakfast and lunch. That's a majority of the meals they eat a day. And it was without question that they were going to receive a meal at school. So once they had to move to start learning from home, a lot of families were, it was scary because they didn't know how they were going to feed their children. A lot of parents work. So if you have a kindergartner and now he has to learn at home on a laptop, how are you going to make sure he's going to eat at the right time, that he's going to log on to class? So I'd like to focus on Edinburgh CISD. They started this large Meals on Wheels program because of how large their district is. Edinburgh CISD covers 945 square miles of the Rio Grande Valley. That's bigger than the size of the state of Rhode Island. And so that means that they have students on the outskirts of the Rio Grande Valley who need a meal. And so if you've seen a school bus around the valley driving around in the past year, you've probably noticed that there weren't students inside. And that's because that school driver is not picking up students anymore. He's not dropping off students. It's because he's taking school lunches and devices and hotspots to neighborhoods. And it's important to know that in the valley, nearly half of the region is nearly half the region is a food desert, and that means that a person has to travel at least 10 miles to buy fruits or vegetables. And so since Edinburgh is one of the most rural cities in the Rio Grande Valley, this is where it was really evident how bad the situation is. Edinburgh CISD would send off 128 buses to go on routes stopping at more than 300 neighborhoods, serving more than 35,000 meals a day. And by the end of 2020, they served 4.5 million free meals. The ECISD transportation coordinator said, "Our primary function in transportation is bringing the kids to school for them to learn. But given the time we are going through with the pandemic, what we're doing is bringing the school to kids." And I'd also like to, one of the other problems that came up from this pandemic is the fact that a lot of kids live in very crowded homes. And Sherryland ISD started this initiative where they gave away desks and chairs to families, because you can't have 5 kids learning remotely in your kitchen table, because if they're actively participating in class, it's not going to work, because they would all be talking at the same time. It would just be very hectic. And so this school district began lending these desks that weren't being used to students so that they could go to their bedrooms and try to find different corners in the house. So the internet connection, this was also an extremely big problem that districts are still facing, but I'd like to concentrate on Donna ISD. So in Donna ISD, they sent a poll to their students. More than half of their students said they did not have Wi-Fi at home. And so not only did the district have to take on the responsibility of distributing laptops and Chromebooks and iPads to their students, they had to make sure they had a connection to use those devices. And so the district spent $3.7 million for a project that would install a dozen Wi-Fi towers across the city. This project hasn't really been successful yet, but this is still an endeavor that's ongoing. Each tower would provide internet within a 1-mile radius to the students, and it was designed so that it would be near the most poorest colonias in the city. Another problem that's come up is funding for districts. So I'd also like to go back to Edinburgh CISD. A couple weeks ago in a school board meeting, Edinburgh CISD revealed that they were missing 1,500 students in their enrollment. These are 1,500 students who just did not come back to school from last year. And the way that funding works in our state is that dependent on attendance of schools, that's how much TEA, the Texas Education Agency, will allot to a district. There's been this hold harmless agreement for the first couple semesters since the pandemic, which would protect school districts from low attendance. But because Edinburgh CISD started this year, the first week of January, not allowing all students to come into their buildings, they no longer qualified for this protection, which means that because Edinburgh CISD was missing 1,500 students, they could lose about $9 million in funding, because TEA gives around $6,000 for every student who attends school. I'd also like to talk about what online learning means for the development of students. Students would spend more of their day, a majority of their day at classrooms. They spend more time of the day with teachers than their own parents. So this was their second home. So suddenly being stripped from the place they were so comfortable in is leaving a lot of students heartbroken and just completely lost. And for the younger students, it poses a big threat to their development. Teachers not only teach math and science and language, students pick up a lot of social skills from their teachers. They pick up moral lessons. They teach how to be good people, how to make friends. And so these are some of the things that they're losing from having to attend classes from a screen. There's also something called Zoom fatigue. So Zoom fatigue is when someone gets so tired from being online because it takes more of an effort to understand communication through a screen. 7% of a message meaning is conveyed through the actual words, but 93% is explained through nonverbal signs, such as tone of voice and hand movements and facial expressions. So learning through a screen and talking to someone through a screen takes a lot more effort and it's more exhausting. That's why meetings really are difficult through online. And imagine having to be online learning math for 8 hours a day. Hands-on activities are also important for students. Learning what's a liquid and solid and gas, seeing those science projects in person are very important for their development, and the inability to play outside. A lot of happiness and joy is tied to that. So students missing out on the time outside with friends is taking a toll on the mental health of students. And also the disruption in the daily schedule of students. Waking up early and putting on uniforms and eating breakfast and going on the school bus is important for students to mentally say, I'm going to school and I'm in an environment to learn, especially for elementary students. Being in classrooms with posters on the wall that that really show that you're here to learn is important for them to flip the switch in their mind and understand that they need to concentrate on their work. It's hard to do it in the same room where they come home to relax, where they come home to play video games. And even more so, it's difficult to do it on a device, on an iPad, on a laptop that they mentally associate with having fun. They go online to talk to their friends. They go online to play video games. It must be difficult for them to just have to suddenly associate it with learning. Mental distress. So because we're already almost nearly at a year of this learning online, there's research that shows that ADHD diagnosis in children is rising. There's a nonprofit called Children and Adults with Attention Deficit Hyperactivity Disorder that where it rose by 62% since the pandemic started, and depression in children has also risen. There have been, unfortunately, multiple cases of suicide in children younger than 18 that have credited, or not credited, that was made worse because of COVID-19. I've explained Zoom fatigue already, but it gets worse because if they're tired, this is a local psychologist said, if they're tired, they're not going to learn. And if they're not learning for a year, the education sector is going to be facing a very difficult challenge once we recover from this pandemic. Beginning in April, mental age-related visits to a large sampling of emergency rooms in 47 states increased by 24 among children ages 5 to 11 and 31% for those 12 to 17 compared to 2019. So on top of having to supply meals, on top of having to supply devices and connections and desks and a good learning environment for students, it's very important to start teaching about mental health and how to teach students how to care for their mental health, because this is something that is a lot to ask for a student to ace a math exam while maintaining friendships and caring for their mental health, all while they're stuck in their house when they were stripped from going to schools where they associated with having fun and making friends and where their lives were. So the next time you see a student, continue to share love and to share awareness of mental health. I'm gonna pass it along to my classmate, Cindy.
Hi, my name is Cindy Us, or Cindy Ustek. I'm hoping you can hear me because I am at UTRGV right now and I am wearing a mask to be safe. So I am a UTRGV undergraduate majoring in anthropology, and my minors are sociology and philosophy. So for the first part of my presentation, I will be discussing the similarities and differences between the 1918 influenza pandemic and the current COVID-19 pandemic. So right away, from the three pictures of this slide, we can already see some of those similarities and differences. For example, the picture on the top right, it comes from the National Archives and Records Administration by the United States federal government. It is captioned as Red Cross workers making anti-influenza masks for soldiers in Camp Boston, Massachusetts. And then on the bottom right picture, it comes from the Los Angeles Times. It was taken around last year in 2020. And it is captioned as Nurses Katrina Rugar, second from left, and Hannah Woodward, second from right, and clinical coordinator Veronica Gomez, right, treat a patient at DHR Health in Edinburgh, Texas, and one of the several new COVID-19 units. And right away, we can clearly see how both of these pictures have the medical workers in medical gowns, in medical caps, and medical masks. They are essentially covering themselves completely to protect themselves against an incredibly contagious and deadly disease. And on the other hand, one of the most notable differences between the medical workers are technological advances of the 21st century. Our current medical professionals are using gas masks to further protect themselves against COVID-19. Red Cross workers, additionally, were the ones sewing masks to protect soldiers from the influenza virus during the Great War, where as of today, in the beginning of the pandemic, the general public, us, we were the ones sewing masks for everyone due to the sudden shortage of mask supplies. Some individuals continue to sew masks to this day, either for personal profit, it's become a small business, or to help the community. Excuse me. This case applies to the bottom left picture, Elizabeth Foley, UTRGV's theater department costume shop manager. So the caption goes that she is cutting plastic to make gowns to be used by the UTRGV School of Medicine of the frontline workers. In fact, UTRGV's theater department stitched over hundreds of face masks, alongside constructing face shields and medical gowns. In other words, we were the ones supporting medical workers. And moving on to the next slide. The slide, please. Oops, sorry. Okay. So I'm going to start off with the similarities, and one of the most obvious ones is how we're discussing global pandemics, but how were they able to become global pandemics? Well, there's a lot of reasons, but for this part of my presentation, I'm only going to list two, which are the following. They were both of these viruses were airborne diseases, which means that it is one of the most infectious and deadliest disease transmissions. It was discussed by Colleen earlier. And also, both of these viruses were severely underestimated by many government officials and the general public. As an example, from my experience, I've asked many of my friends and family members, when did they first hear about COVID-19? And I get many different answers, ranging from early January of 2020 to mid-March of 2020. It was around the time of spring break vacation, to be exact. Then I asked them, were you initially worried about COVID-19? And all of them have given me the same answer, which is a simple no. And when I asked for an explanation as to why they weren't worried, some say that they believe that it was just a disease that wouldn't spread far, especially down here in the valley. Some thought if it comes, it will go away easily. Some weren't even aware of how fast the disease was spreading. And as for the 1918 influenza, the Great War overshadowed the pandemic. So due to our, you could say, negligence of the disease, both of these diseases were able to spread so quickly that before we knew it, there were bans on public gatherings, schools and businesses were forced to shut down, and all of these were implemented to slow the spread of the virus. And what if someone were to go out in public to get essentials? Well, social distancing guidelines and mask mandates were established to prevent the disease from further spreading. However, these regulations were met with some opposition. The most notable of these oppositions comes from anti-maskers, also known as groups of individuals who protest against mask mandates. In fact, for the CHAPS course last semester, we had a student who worked in the medical clinic, and she recounted a story of how a patient came into the clinic without wearing a mask. So when this patient was confronted about it and asked to wear a mask, the patient refused to comply and actually left the clinic. Now, if we move on to the differences, one of the most obvious ones was the world population in 1918, which was around 2 billion, and our current world population, which is 7.7 billion. Because of this, there are many speculations regarding which pandemic will be deadlier. There could be a possibility that COVID-19 will have more deaths due to our current big world population. However, it is also possible COVID-19 will have less deaths due to the advancements in technology. And additionally, there are more cases of people recovering from COVID-19 than cases of people dying of COVID-19. And I would just like to say I am in no way underestimating the deaths of COVID-19 at all. And moving on to the second difference, we have the highest fatality rates by age. So something that was really interesting about the 1918 influenza pandemic is that those from ages from their early 20s to their early 40s, they were the ones most at risk, because the younger generation was the one most affected by the 1918 influenza. It is speculated by scientists that a predecessor of the 1918 influenza virus, or a similar virus of the sort, existed around the 19th century, mostly the mid-19th century, due to how the older generation seemed to be immune to the 1918 influenza. However, this is just speculation due to the limit of resources available at the time. And for the COVID-19 pandemic, those ages from their mid-50s and older are the ones most at risk. It seems to be a new disease for humankind, which may explain why the older generation is the one most at risk. Due to their old age, their immune systems cannot fight a new disease, unlike the immune systems of the younger generation. Additionally, another difference is that in 1918, there was no air travel. In fact, it is speculated that the reason why the 1918 influenza spread so fast was because of soldier mobilization due to the Great War. In fact, the first possible cases of the 1918 influenza seem to have originated on early March 1918 in Camp Funston, a military training camp in the United States, specifically Kansas. And then our current age, due to our modern age, we have air travel, which makes the world much more connected than we ever were. And this also allowed COVID-19 to spread incredibly faster. Also, I really like this difference. It is the scientific knowledge and the technological advances from 100 years ago. So when the 1918 influenza pandemic began, nobody really knew what was happening. In fact, nobody knew that it was a virus, and many called it a bacteria, because there were no laboratory tests to identify the virus. And it wasn't until 1997 when scientists finally found a breakthrough about the 1918 influenza. Using preserved lung tissues from 1918, scientists were able to partially characterize fragments of the virus's RNA almost 80 years after. Nowadays, we have constant updates about COVID-19, including the virus's genome sequencing. For example, around January 5th, 2020, Professor Sheng Yongshen and his medical team from China were able to create the first genome of COVID-19. And this is how the world found out extremely quickly that we were dealing with the SARS virus. Another notable difference is that the 1918 influenza was quickly forgotten, and it goes back to how it was heavily overshadowed by the Great War. It did exist in the people's subconscious, but it wasn't something that was talked about, unlike the Great War. But for the COVID-19 pandemic, it's something that just cannot be forgotten. As an example, we're doing this presentation online. As Colleen mentioned earlier, classes are also being held online. It's impacting us both physically and mentally. It's become a part of our everyday lives. So moving on to the third slide, please. So before I begin my presentation, I would love to credit Jose L. Garcia III. His final essay-project for the CHAPS program discusses how the media outside of the RGV portrays the region's battle against COVID-19. He begins by describing how big news outlets like Vox, the LA Times, and the New York Times have cited the Rio Grande Valley as a hotspot for COVID-19. Now, Colleen mentioned some numbers from around February 19th of this year. Well, I have some numbers from February 22nd. So all of South Texas has a combination of 121,561 plus cases confirmed. And there's also been 4,367 plus deaths confirmed in the entire region. So many of these articles constantly state that the same reasons as to why the RGV has suffered from the COVID pandemic are chronic illnesses, such as diabetes and obesity, once again discussed by Colleen, poverty, pachangas, family gatherings, close-knit communities, and the high Mexican American population. However, this is just scratching the surface, and I would like to further discuss, with the exception of chronic illnesses, why these problems persist in the RGV. It's important to discuss this because, as Garcia wrote, news coverages can affect one's daily life, especially during the time of crisis. So, to the next slide, please. We begin with COVID-19 awareness. The first PowerPoint says lack of media coverage in Spanish. And I decided, after reading this, I kind of decided to Google and Bing the following. I decided to look up Rio Grande Valley Noticias, and I got the same, I only got 4 Spanish news media down here in the valley. It was Azteca Valle, Telemundo 40, El Periódico USA, and Noticias Ya, also known as Noticias 48. And additionally, there are language barriers in public spaces. For example, while it was common knowledge to wear a mask and social distance when one is out in public, it is considered the new normal, there was a time where this wasn't the case. There were conflicting reports about the regulations put into place about whether one had to wear a mask or not, and what was considered social distancing, not to mention that different regions had different regulations as well. Well, in order to keep the public updated, a lot of public businesses and public places put signs on their doors saying wear a mask, which is still practiced today. However, some public businesses and public places in the RGV only had a sign in English, not in Spanish. And I find this to be incredibly ironic for the Rio Grande Valley, especially considering that we're a borderland. We are being ignorant of one of our prominent languages, which is Spanish. Now, moving on, I want to discuss the socioeconomic status, specifically those of undocumented immigrants, because it is a well-known fact that many undocumented immigrants reside in the Rio Grande Valley because our region is a border town. Of course, these immigrants are first generation in their, meaning that they're the first in their family to reside in a different country, and that raises a lot of challenges. One of these challenges is often working for low-paying jobs to support their families, and these jobs tend to be frontline work, such as working for the agriculture industry and customer service, most notably restaurant businesses. And because of this, it is not possible for these immigrants to work from home. Their jobs require them to report in person, and these jobs are heavily contact related. So much to the point that many of these jobs, going back to agriculture and customer service, were considered essential at the beginning of the pandemic. Also, because of their status in this country and their jobs considered essential, many of these individuals could not apply for employment benefits at the start of the pandemic. They seem to have no choice but to risk their lives to provide for their families. So, moving on to poor access to healthcare. Going back to immigrants, this case, both documented or undocumented immigrants may not be eligible for healthcare insurance at all. Healthcare insurance is in fact considered a privilege, especially because it is mostly US citizens who can have access to it. And for those that lack healthcare insurance, they decide not to get treatment until it is too late, when their diseases like chronic illnesses like obesity or diabetes, get worse to the point that there is no point of return for these people. So there's also the lack of information and financial strengths. I call this the US citizens. Sometimes your insurance doesn't cover this procedure. So this is a problem that US citizens face. Healthcare insurance has become a complicated issue and a controversial topic. Many criticize healthcare insurance for focusing more on profit than actually helping and caring for individuals. As an example, there are a number of private healthcare companies, each with their own different insurance plans. Some people find these plans to be expensive or simply don't understand the purpose of these plans and therefore decide not to get healthcare insurance at all. And so for this research, I came across a website called healthcare.gov, where it describes a couple of insurance plans. And one of these plans goes as follows. It is called Point of Service, POS. It is a type of plan where you pay less if you use doctors, hospitals, and other healthcare providers that belong to the plan's network. POS plans require you to get a referral from your primary care doctor in order to see a specialist. So you can already see how your healthcare insurance may not cover some aspects. So lastly, we already established that the RGV is a region where poverty is relevant. Unfortunately, people have to make decisions to make ends meet. And sometimes that decision is to not get healthcare insurance at all, so that one is able to afford to put food on the table and pay other bills, such as light and water. And once again, most of these companies can be intimidating and expensive for many of the people down here. And so to conclude this part of my presentation, I would like to state that COVID-19 has now more than ever highlighted the problems of the RGV and the United States. Not only do we seem to be ignorant of the past, as demonstrated by the comparisons and differences of the 1918 influenza pandemic and the current COVID-19 pandemic, but it's obvious that this system, whatever you want to call it, isn't perfect. One could even argue that it isn't working. And I also feel like this pandemic has made people in the Valley realize that while we tend to notice what happens around us, we don't tend to notice what happens to us, what is happening in our region. I don't think people should easily brush off the COVID-19 pandemic. We did that with, once again, the 1918 influenza pandemic, and this is where we are right now. I think we should take this time to reflect and to fix things that are broken. And for us in the Rio Grande Valley, it can start in our borderlands. Thank you.
Okay, just real quick, we're okay with time? Like, it's okay if okay. So, hello everyone. My name is Nidia, and I will be speaking on the messages that students hope to convey from the book in the following slides. To continue with one of the topics of choice by students, I will be speaking on immigration and how the pandemic affected that population of people who make up a large portion of our community. The image you see here can be found on RGV Eco Voice Network's website. At the time this was shared, the coronavirus was spreading through these detention centers. According to the International Rescue Committee, over 20% of the ICE detained population tested positive in their facilities with unsanitary and overcrowded conditions, and yet ICE continued to underreport their COVID cases. In response to ICE's continued negligence, this message was projected as an action in solidarity with immigrants in these detention centers. Next slide, please. So Fatima Garza was able to interview Roberto Lopez of the Texas Civil Rights Project, and they spoke on the deadly effects our government's anti-immigration agenda has had in our region. The number of separations did not change during a pandemic, a worldwide human crisis, and companies like ICE continued their illegal operations against asylum seekers. In June of 2020, Lopez with TCRP learned about the children being held for deportation in the Hampton Inn Hotel in McAllen, Texas. In this image to the left is a snapshot of the video that circulated and became viral. The video depicted the gentleman of TCRP who attempted to enter the floor those families were being held in, and in the process, these men who would not identify themselves physically shoved them into the elevator, thus denying the free aid they were providing to these children. Fatima also found that Title 42 was cited by the Trump administration, which allowed officials to quickly return migrants who crossed the border, these families and children who are supposed to go through a formal legal process. This policy was included as part of the CDC guidelines, but the former administration abused this power. That was the first time it had been used as a policy to prevent groups from seeking asylum. The next slide, please. Chelsea Sandoval, in her paper, discusses medical migration and a phenomenon known as medical tourism. Her findings pointed at the use of this privilege by the elite, who take advantage at obtaining services from around the world. But she also highlights that here in the Rio Grande Valley, this action is taken out of necessity. For our specific region, she uses the term medical migration, or our own community members seeking services, pharmaceuticals, and healthcare across the southern border. She found that the implementation of the final public charge rule left many immigrant families in fear of jeopardizing their status, thus disenrolling from SNAP programs, leaving them to face the deadly issue of food insecurity. During this pandemic, even though the Department of U.S. Citizenship and Immigration Services issued an injunction that should have prevented the Department of Homeland Security from enforcing this rule, immigrant families still had the fear of deportation, and so they refused to seek out the proper medical care or aid. Next slide. David Cantu and his interview with Nero demonstrate the constant perils immigrant families must face. Nero, who has been separated from his father with the physical border, continues to choose to avoid contact with him despite what that means for his family, in their case a heavy financial burden. There is also that fear of not being allowed re-entrance without proper documentation. If this new border restrictions incite fear in residents, asylum seekers are left entirely vulnerable with life-threatening challenges. So living near the South Texas border, it is important for us to realize that our public servants are as dangerous as a pandemic to asylum seekers. The next slide. More recently, the university UTRGV has received criticism for denying a vaccine for a deadly virus to an elderly man. The person they denied it to is the father of a Lopez staff member, Abraham Diaz. Diaz said, UTRGV did not deny my dad based on proof of residence. They denied him based on proof of immigration status. They humiliated him by denying him life-saving care and then announced it in front of other patients. La Unión del Pueblo quickly released a petition that asked UTRGV to release the name of the official who decided to implement this policy and under what circumstances they implemented it. They asked him to pledge not to deny any eligible person based on immigration status, to quickly launch an education campaign in Spanish with the message that the vaccine is for everyone regardless of immigration status. By not recognizing that they wrongly asked for immigration status, UTRGV could not ensure that they won't repeat the error in the future. More recently, UTRGV has issued an apology followed by a clear statement where they do in fact state that they denied the vaccine to 14 people, but have now rescheduled those same people. Because of how publicly vague our government's response was to the pandemic and our own institution, it is important to keep each other informed and follow organizations like RGV Eco Voice Network, who are actively on the ground with these families, providing the necessary information for safety and survival. And then I think Cindy is next. Yep.
Hi, so it's me again, and I want to quickly discuss restaurants. And it is extremely chaotic to keep up with the news of the, for example, capacities that businesses have to follow. I even made a timeline, and there's a lot of executive orders that I actually read. So yeah, that was fun. So we're going to start off with March 19 of 2020. And it states Texas Governor Greg Abbott issues executive order that prohibits eating and drinking inside restaurants and bars. But takeout is still available. A day later, Abbott announces that small businesses can apply for long-term, low-interest loans from the U.S. Small Business Administration, also SBA. And then around May 2020, under the Executive Order GA-17, restaurants are allowed to open at 25% capacity on May 1st. By May 22nd, restaurants are allowed to operate at 50% under Executive Order GA-23. By May 26th, an extension of Executive Order GA-23 allows for food courts to reopen. And then we move on to June 2020, and it starts off with June 3rd, which states Executive Order GA-26 states all businesses can operate at 50% capacity. And this order also allows restaurants to expand to 75% capacity on June 12. On June 26, Executive Order GA-28 is published. Due to the COVID-19 cases and deaths escalating, all bars are to be closed and restaurants are to reduce their capacity to 50% on June 29. Then moving on to September 2020, published on September 17, Executive Order GA-31 allows for restaurants and other businesses to maintain a 75% capacity, except for 3 hospital regions, the Rio Grande Valley, Laredo, and Victoria. This was due to the hospitalization in those areas reaching the danger zone. And the way Greg Abbott defined this is places where COVID-19 patients make up 15% or more of all hospitalizations for 7 consecutive days. And then as more recent, which was actually 2 days ago, on February 23rd, 2020, Hidalgo and Cameron counties have announced that businesses can now operate at 75% capacity and bars can now operate at 50% capacity. And this is due to the increasing number of COVID-19 patients in the RGV region. So moving on to the next slide, please. During this time, one of the most striking things that happened were the employee benefits. With the sudden closure of numerous businesses, restaurants and employees found themselves without a job, and many of them quickly rushed to apply for unemployment benefits online. And since many people were applying for unemployment benefits at the same time, the website continuously crashed. And if you look at the statistics, it mentions how before the pandemic, it was estimated that around 16,000 Texans had applied for unemployment benefits. And a week after businesses closed due to the pandemic, that number skyrocketed it to 155,000 Texans. It was an 860% jump. So moving on, we have how small businesses have been competing against big corporations for the longest time, but now they are competing with big corporations and COVID-19. So small businesses account for over 44% of the economy. And I am in no way denying that big corporations lost profits when the shutdown occurred. Some continue to struggle to make profits they used to before the pandemic. But now small businesses are struggling even more than big corporations. So much so that a lot of small businesses have permanently closed. And because of this, and in case you don't understand how alarming it is what the small businesses are going through, U.S. government has provided relief through the Small Business Administration loans. And a lot of owners applied for these. And they have stated that they use these loans to pay for their employees, to pay rent and bills, excuse me. And also, they also use the money to adapt to the new normal, which means buying hand sanitizers and Lysol. In fact, a lot of businesses need to have hand sanitizers implemented. If not, they run the risk of shutting down immediately if a health professional were to see that. And also, adapting to the new normal means buying masks and gloves for your employees and even for yourself. So, one last thing I would like to say for my presentation. I used Ramon Navarro's final project as essay for the CHAPS program. The essay is titled Small Businesses, Big Battle: How Businesses Are Adapting to the Impacts of COVID-19. And for his research, he investigates and interviews the owner of a small restaurant business named Taqueria La Regia, located in Donna, Texas. The owner's name is Jesus Villarreal, the man Ramon interviewed. So if you want to support a small local business and you're in the Donna area, you can consider checking them out. Thank you.
Okay, so moving into another choice of topic by students was social gatherings or events, places that would normally bring together large amounts of people. The image here is from an article by the New York Times. In Elsa, Texas, Johnny Salinas Jr., owner of Salinas Funeral Home, typically handled 5 funerals a week, but the death toll that appeared during the pandemic forced funeral directors like himself to bypass traditional services such as velorios and viewings that sometimes last for days and are filled with prayers and hugs. Instead, funeral homes like Salinas's have had to shorten viewings as a result. Next slide, please. So our proximity to Mexico means having a combination of healing and medical practices. In his essay, Now and at the Hour of Our Death, grad student Gabriel Osuna highlights the social impact of the pandemic by looking at the Catholic Church. He documents the ministerial efforts to serve the faithful amid the challenges of a modern-day plague. Even though the Catholic Diocese of Brownsville closed all parishes until further notice, Bishop Flores eventually received approval to hold socially distanced confessions outside under a tree in front of a church. Hospitalization restrictions left family members out in the parking lots praying for their loved ones inside the facilities. So in turn, believers of faith across the valley gathered to pray for miracles and healing. Alternative healing methods are also prominent in our region, like curanderismo, which is a measure taken for a person's physical, emotional, and spiritual ailments. Individuals left with feelings of sorrow, guilt, or who have fallen ill go through a ritual known as a limpia. As Gabriel states, the COVID-19 pandemic ought to remind the faithful that hope does not come from those in this world who falsely promise an escape from death, but rather from the one they believe conquered death. Next slide, please. So Tommy O. Johnson and Jonathan Gutierrez add perspective to the effects the pandemic had on athletic students across the Rio Grande Valley. Like Sunday Mass, the Friday night lights bring a lot of Valley residents together, and like most sport events, this involves large gatherings. But with the pandemic, the health and safety of students and their families must come first. This loss of a football season was particularly voiced by high school seniors. The frustration was shared among 27 high schools across the valley, in the end allowing students back to the field in the fall of 2020. La Jolla ISD, in particular, was faced with a petition to revisit their decision to forego the fall 2020 season. This extended to the collegiate level, where Vaquero seniors had to make a decision of whether to add another year of studies or graduate with no opportunity to showcase themselves on the fields. The image on this slide was taken by Tommy, and it shows the Mercedes football team standing united, what Tommy calls an example of resilience during such a turbulent time. Next slide. Thank you. Megan Olmedo discusses the measures the Valley took during the 2020 presidential election. She sat down with Jeff Schwett, a longtime poll worker, whose majority of 15 years have been in Donna. Having worked presidential elections to school board elections, he gives a unique perspective on the changes that had to be taken for a safe election. With her focus in Hidalgo County, she found close to 400,000 registered voters and 74 polling locations. Normally, the voting would take place for 2 weeks, but last year it was extended for another week. So like masks, there was controversy with the entire process of mail-in ballots, arguing that this would allow voter fraud. Despite the efforts to manipulate the voter turnout in a predominantly Democratic region, the 2020 election broke records in many counties across the board. In the image you see here, at first glance you might think that this was the entrance to a hospital or a clinic, when in fact, you would have been approached and guided by a poll worker like Jeff. With polling locations constantly having an influx of people, it was extremely important to take any and all precautions to ensure a safe process. Next slide. So in this chapter, I discussed the ways that art can have a positive impact on a community's public health. The image you see here is by artist Virginia Contreras, a UTRGV alumni, and I chose this image because it was made for the people of the Rio Grande Valley. With the palm trees, músicos, and the piñata, it reminds me of every celebration families here have and what they are made up of. There is unity and celebration in this print that reflects what we know the Valley has. Next slide. I was able to find this framework by the University of Florida that lays out the benefits arts and culture can have, especially at a time when social distance is necessary for survival. Things like social media platforms are what is keeping families and friends connected. As creatives, we facilitate the dialogue when we are able to communicate creatively, even about difficult topics. Dr. Felton Earle's research in neighborhoods in Chicago led him to find what he calls collective efficacy, or the willingness of people to come together and act upon a common interest. In the case of art, creatives and organizers here in the Valley, their response to the pandemic was by providing aid services and information to our residents. Next slide. Thank you. Online artists continue to create and inform their friends and families through digital illustrations and posts. Like my interviewees, Emma and Nancy Guevara, we are leaning towards more trusted social media sources, people you know that are only working towards the betterment of our region. There is also the necessity to make sure that our region is receiving bilingual information. A prime example of a guided and engaging infographic is shown here on this slide. The impact is made through the representational and memorable imagery that eases the dialogue of a topic like a deadly virus. From Chelsea's report, she states that an individual's social network is one of the most important aspects of human life, and a good and supportive network will aid our communities in the process of accessing things like healthcare. Next slide, please. So the collectives and organizations that are listed here are among the few who are actively working towards sharing accessible information and honest stories of the people of the Rio Grande Valley. But they also provide direct aid and funds to our immigrant friends, houseless folks, those who are economically constrained, and all vulnerable populations that have been at greater risk, not only through the pandemic, but also Hurricane Hannah and the Texas winter freeze more recently. I would like to quote Dr. Megan Venable Thomas, who states that recognizing the importance of cultural resilience as a viable approach for community development and community building is extremely important, because research, health, and community development decisions are still being made without the inclusion or voice of those most impacted by those same decisions. This is a mechanism for inclusiveness. Organizers and artists who are already doing this here in the Valley hold an immense importance in movements to progress, as they can be informative and the art can be thought-provoking and unifying. And my last slide. Thank you. In an area already affected by the negative remarks of a racist government, the pandemic only brought more woe. Nancy Guevara shared that she does not in fact hope that we go back to normal, because going back to normal means going back to a system that failed us all and instead was in place for capitalistic profit. Creative placemaking strategies, as called by las imaginistas, are important in developing environments of collaboration that in turn create resilient communities when disaster strikes. An example of that would be public art, and this mural in San Juan demonstrates the representative imagery and how that allows us to literally paint a different picture of the valley. Integrating art and cultura to the process of healing has its benefits for our residents here. So to end my part of the presentation, I would like to say that ultimately we can start by supporting those who are doing that work already here in the RGV. When I say creatives and artists and organizations, that includes programs like the CHAPS program, as well as creative writers and musicians. These groups and many others have been able to reach many residents, but there is always room for them to grow, and that is where their community comes in order to uplift them. And in that process, we are uplifting the voiceless. Thank you.
Okay, well, I would like to congratulate the girls, the ladies, Colleen and Cindy and Nydia, for giving us a fantastic presentation and rundown of what we researched for the CHAPS class in the fall of 2020 with regard to the COVID-19 pandemic and its effect in real time on the Rio Grande Valley of Texas. They went over and above with this presentation by examining in detail their fellow students' presentations and their fellow students' research papers, of whom they've credited throughout the presentation today. And they extended the research that was completed in the fall of 2020's semester by bringing it all together in this wonderful compacted presentation and bringing us up to date with the laws and statistics that we find ourselves in today in February of 2021. So I want to congratulate the ladies who gave this presentation to you today. They did a wonderful job, and I'd like to thank them very, very much for their time and attention to this project. And so what we wanted to accomplish with this class is exactly what Nydia just said, is to literally paint a different picture of the Rio Grande Valley of Texas for those who are looking in on us from the outside. And I think the students did just that. So we are very happy to have been the mentors of this project as a whole and been part of the educational process through which these students learn and we hope have grown tremendously. And so with regard to this being the end of the presentation, this class and the reports and the research that the students, all 25 students in this class conducted, is going to be compiled into a published report, hopefully by the end of the summer, definitely by the end of 2021. We will have everything put together and developed into a published and printed report that each student in the class will get a complimentary copy of, and all the libraries, at least in Hidalgo County, will get a copy of it so that their patrons can use it and learn from it. And we will also be posting it on our CHAPS website, as we will be posting this wonderful recorded presentation. So what is on the slide right now for you just to take a quick look at is the table of contents for that published report that we plan to complete hopefully by the end of the summer of 2021. And what is represented here is all of the reports that the students produced in the fall of 2020 semester in our CHAPS Discovering the Rio Grande Valley class. One last thing before I open it up to some questions and or comments. The cover of this report is what you saw on the first slide in this presentation. And the cover art is credited to an artist named Emma Guevara, and our very own Nydia Salinas was in charge of editing that artwork and creating the very interesting cover that we are going to put with this report. So not only do the students in our class have the opportunity to do regional research and have it be protected and published and available for current students and scholars, as well as future students and scholars to study Rio Grande Valley history, they also have these opportunities to create art as well to assist us with the creative design of the cover of the report. So with all that being said, I'd like to ask Dr. Skowronek if he would like to make a few comments, and then we can open it up to some questions from the audience.
Thank you very much, Professor Bachagarza. And I want to personally thank Colleen, Cindy, and Nydia for this fabulous presentation, and also to the members of the class who conducted this research. As you've just heard from Professor Bachagarza, this may not be what we normally do, but we have not had a normal year this year. And I think for me, a huge takeaway from our presentation now and from the fall is that the stories you have captured over the course of that semester are specific to our home. And when we think back on what Cindy pointed out about what happened a century ago, we are drawing on a much grander scale from across the United States of the world, because our records from 1918 in the Valley are just not as nearly complete. I can only hope that this sort of pandemic never revisits us again, or your children, or your grandchildren, or great-grandchildren. But the day may come that it does. And I think armed with your work, they will have a better sense of what their grandparents or great-grandparents experienced, and might find a better way to chart their course than some of the pitfalls that we fell in. A hearty well done to you all. Stay safe and healthy. I'll turn it back to you, Professor Bachagarza.
Okay, and then I'd also like to thank those in the audience who have tuned in. We certainly hope you found this interesting and intriguing, and we would like to ask if you have any questions for either Dr. Skowronek and myself, or of the three students who conducted this project presentation to you today. Rodrigo?
Yes, I was wondering if when they were conducting the project, did they see any signs of perhaps we might be losing a lot of teachers or frontline workers because of what's happened?
Ladies, any of you want to comment on that? Did you notice anything in the research?
I'm going to pick on you, Colleen. You were the one that pointed out our 1,500 missing students. Any sense of what's happening with the teaching?
The teaching. So I mentioned that, I'm sorry, do you hear my dog? He's barking. The reason I mentioned that Edinburgh CISD, they didn't qualify for the hold harmless agreement for this third 6-week period, because they did not open their school campuses to all students. And that really started because of an initiative that Edinburgh teachers started. There's been a lot of pushback from teachers saying that during the winter break that they did not want to go back to campus while their school board members were pushing for them to go back to classrooms. And I don't know how many teachers have resigned because of this pandemic, but I do know that the district was struggling to find teachers who are willing to go into campuses and classrooms to take care of the students who are coming to campus, because a lot of students are going to campus because they have to. Their parents are not home. They're too young to be at home alone. And so I know that in a school board meeting for Edinburgh CISD, there was a board member who said, who's going to take care of these students? Should we hire a bunch of substitutes? And so there's just a lot of pushback, and I'm wondering that too, but I don't have the numbers for how many teachers have resigned.
And I see we have a raised hand by Mark Trejo. He was one of the students in the class, and I believe, Mark, you did write about education. Do you have some comments to add?
Yes. You know, right now from last semester, you know, I'm in my final stages of school. I'm the clinical teacher at school in Edinburgh, ECISD. And, you know, we've seen a very significant rise in the number of teachers who don't want to return. You know, that's to do with the students also. You know, they're starting to, like Colleen said, right, students are too young. You know, they're kind of being forced in a way to go to school because, you know, no one's there to take care of them. You know, they might not have any food, and that's the only food they might be able to eat. And this is also putting a lot of stress on the teachers, because even in clinical teaching, right, we were told that going to this program, we were going to be on campus, we're going to be interactive, you know, we're going to be teaching physically in class. And now that it's online, you know, even my teacher, the one I'm mentoring under, she's having a hard time. She's struggling mentally. You know, we all are, and it's very different, right? Because the kids, you know, kind of like, hold on for a second, kind of like me. So I wasn't showing my face. That's what they see most of the time. That's what we see all day. They're not really interactive. They're not choosing to speak off of the cameras. You know, they're not required to show their face in class because, you know, we don't know what's going on in the background of their houses. And so most of the time we get, all right, guys, are ready to move on? Did anyone have any questions? And it's just silent for maybe 5-10 minutes. And it's a struggle, you know, as a teacher, you want that interaction, right? You want them to participate in class, and you can't get that through an online screen. So the number of teachers to resign has gone up. And as a result, I don't want to sound mean, right? Like, in a way that's good for me because I'm going to have a job after I finish this. But at the same time, the quality of teacher is going down.
Well, thank you. Thank you for those comments, Mark. Does anybody have any other comments to add to that, or a new question?
I would just like to state that I have a sister, an older sister, who tutors in the math department in UTRGV. So she has been doing this for, I want to say, 2 years when she started graduate school. And now she's tutoring online, and she's also seems very disillusioned with having to do this on a screen. She doesn't like it, and she does wish things can go back to normal. And my fiance, his mom, is a teacher for the FAR district, and I know she's been wanting to do something else. That's why she went back to school and got her master's. But the pandemic kind of halted that, and she's teaching. She doesn't mind it, but she'll like to try something else. And now more than ever, she does want to try something else because she doesn't want to teach on a screen anymore.
Something I'd like to add is that I listened on NPR today that, actually not NPR, Texas Tribune, their podcast, that there are current conversations happening at the state level of who should get the vaccine next. And because we're currently going through the group 1B, which consisted of those who are older than 65, those with comorbidities like diabetes and obesity, now it's pretty hazy who's next. but teachers are high up there and who will qualify for the next round of vaccines. Though I'm not saying that it's certain, but it's in the conversation.
Thank you, Colleen. Anybody else have any comments with regard to education or an additional question? Anybody? Okay, well, we are at 6:30. We've been online for an hour and a half. I think we've had a wonderful program. So I think we can just go ahead and stop here. If you can move on to the next slide. I promised I would put the additional information back up with regard to the CHAPS program here at UTRGV. And this is the class that we taught in the fall of 2020. And so these are the call numbers. If those of you who are students online, I do see our CHAPS undergraduate assistant, Catherine Lozano, on here, who also took this course from us in the fall of 2019. So she can attest to the course and what we cover and what we accomplish. So if there's any of you students who are watching today and are interested in taking this course from us in the fall semester of 2021, hopefully we will be lifted mostly from the coronavirus or COVID-19 pandemic restrictions, and we'll be able to resume to our farming family studies. This is a course that we've been running for 10 years. This was completing our 10th year. So we've been doing this for a decade, and every student in the course becomes a published author after it's over once we publish the printed report. So this is a very exciting thing for the students to be able to put this on their resume before they even graduate from college. And so this is a nice feather in the cap for everybody who participated with us. So on that note, if you are interested, here is the contact information for the CHAPS program. And please feel free to contact us and with any questions or comments. And with that, I would like to, I will go ahead and stop recording and then say good night. So thank you for tuning in.